Good morning. Welcome back to Open Med School. Today I am going to discuss with you CBME Internal Medicine 1.6. That is the compensatory mechanisms involved in heart failure. So we know that heart failure is a complex syndrome where the heart is unable to pump blood to meet the metabolic demands of the heart or can do it elevated filling pressures. When the heart fails, the immediate support is by the sympathetic nervous system. That is, the sympathetic nervous system activation is the initial step. Then other neurohormones, especially the RAS, renin, angiotensin, aldosterone comes into play, and later there will be cardiac remodeling. So basically the compensatory mechanisms are cardiac remodeling and activation of the neurohormonal adaptations. First we go into cardiac remodeling. What is cardiac remodeling? Cardiac remodeling is any change in the structure or function of the heart. There are basically three things. One is hypertrophy, second is dilation, third is fibrosis. Take an example of a patient who has undergone myocardial infarction. There will be area of tissue which is infarcted. Later, it will be replaced with a fibrous tissue, which is a protective mechanism. But later, this can produce stretching, elongation, and changes in the shape of the myocardium, and the contraction of the heart can be affected. Another mechanism is hypertrophy of the muscle that is occurring. This can be a concentric hypertrophy, that is thickening of the ventricle occurs at the expense of the cavity, or simply dilation of the heart, that is called the eccentric hypertrophy. So all this will produce changes in the shape, and this will affect the contractility of the heart. The neurohormonal mechanisms will also produce or is a reason for the structural remodeling that is occurring. Now going to the neurohormonal adaptations. As I had told, activation of the sympathetic nervous system is fundamental. Any patient with heart failure, there is autonomic activation, and that is why the heart rate appears to be increased. Most patients will have a increased heart rate. When the cardiac output decreases or the blood pressure comes down, the baroreceptor becomes functional. So when the BP comes down, the signals going from the heart via vagus and glossopharyngeal to the medulla is decreased, because baroreceptors are basically stretch receptors. So this will lead on to activation of the vasomotor centers in the medulla. This will lead on to activation of the sympathetic nervous system, and this will lead on to release of epinephrine and norepinephrine. It will activate the adrenal medulla, and epinephrine and norepinephrine is released. Release of these hormones will act on the heart, and this will produce increase in the heart rate, increased contraction, and this will help in maintaining the blood pressure and improving the cardiac output. So neural support, especially the activation of the sympathetic nervous system, is fundamental compensatory mechanism that is occurring in heart failure. Now we go into the renin-angiotensin system. When the sympathetics are stimulated, that will also produce activation of the secretion of renin. So sympathetic nervous system stimulation and renin-angiotensin system is complementary. Sympathetic stimulation leads on to activation of the RAS. So here you can see the sympathetic nervous system activation. There is a vasospasm, decrease in blood flow going to the limbs, and the stimulation of the beta receptors leading on to increased heart rate, increased contractility. The renin-angiotensin system is activated when there is decreased blood flow going to the kidneys. Renin is secreted from the juxtaglomerular apparatus, and that is act on the angiotensinogen which is produced from the liver. Renin converts it into angiotensin 1. Angiotensin 1 will be acted upon by angiotensin converting enzyme, and the angiotensin 2 is formed. Angiotensin 2 will act on the adrenal gland, produces aldosterone. This will produce reabsorption of sodium and water and help to maintain the blood volume. At the same time, angiotensin 2 is a potent vasoconstrictor. This will again lead on to increase in the blood pressure and try to maintain the blood pressure and cardiac output. So RAS activation and sympathetic nervous system is an adaptive thing that occurs in heart failure, and in the initial phases it will compensate the cardiac dysfunction. When the atria is stressed, there are low pressure baroreceptors are there in the atria. They will produce stretching, and this will release the atrial natriuretic peptides, and the ventricle there is a brain natriuretic peptides. So A and B has got opposite action for the RAS. This will act on the blood vessels and produces vasodilation. Whereas angiotensin is a vasoconstrictor. This will act on the kidneys and produces natriuresis. Sodium and water is lost. Exact opposite action of the renin-angiotensin system. This will decrease the secretion of renin. Renin is decreased, so the aldosterone is decreased, again helping to decrease the fluid retention. It has got some action on secretion of the aldosterone also, so it decreases the secretion of aldosterone from the zona glomerulosa. So A and B will try to neutralize the effect of the renin-angiotensin aldosterone system. Initial phases, this renin-angiotensin aldosterone and sympathetic activation are supportive, but later it becomes maladaptive, and this will lead on to worsening of the cardiac function, leads on to ventricular remodeling, and further worsens the cardiac failure. Targeting on this adaptive system or maladaptive system is important in management of heart failure. That is why we should know the compensatory mechanisms, and the treatment we use beta blockers, RAS blockers to manage heart failure.